You have found a breast lump. What should you do? Should you panic? Many women immediately will think about breast cancer. But the good news is not all breast lumps are dangerous. So in this video, I will answer some of the common favorite questions asked by my patients in my clinic. So you may have found a breast lump or a breast screening report mentioned that there is a breast lump. What should you do? Firstly, don't panic. Most breast lumps are not emergencies, but they should never be left alone. What you can do is arrange to see your doctor or your breast surgeon for an assessment. Do ask for a mammogram or a breast ultrasound if you have not done so in the past 1 year. No, most breast lumps are not cancerous and they are not dangerous. Approximately 80% are benign and only 20% may be suspicious or cancerous. What are the common causes of breast lumps? They can be breast cysts, fibroadenoma, a fibrocystic changes, sometimes infection or breast abscess, a papilloma, can be a lipoma, rarely about 20% can be a breast cancer. How does a breast lump feel? A breast lump often feels like a marble or a grape underneath your skin. Most women will describe it as feeling similar to gently pressing on your eyeball. So if you close your eyes, you can feel your eyeball through your closed eyelid. So sometimes the breast lump will feel something like this. What is breast self-examination? Breast self-examination or BSE is simply a way of checking your own breast once a month or as often as possible so that you are familiar with what is normal for you. The aim is not to diagnose a breast cancer through doing a breast self-examination, but it is to help you to notice if there's any new or unusual changes, such as a new lump or skin changes or any nipple changes and persistent pain. So the earlier you notice any new changes, the earlier you can seek medical advice. Do breast lumps hurt? Usually no. Breast lumps, including breast cancer, are painless. They are not painful. Why do I have breast pain? Breast pain is very common and it is not caused by breast cancer. It is often due to the physiological hormonal changes in women, especially during their menstrual period. Is breast pain a sign of breast cancer? No. Breast cancer is usually painless in the early stages. Breast pain alone is not the first sign of breast cancer. But if you have any persistent pain that lasts longer than usual and it is associated with a new change in the breast or any new lumps, nipple or skin changes, any unusual discharge, then please see a doctor for an assessment. Can breast lumps disappear? Yes, especially small cysts or hormonal breast changes. Some can disappear after the menstrual cycle, but others may remain unchanged for many years. How do doctors find out what the lump is? Your doctor will arrange a triple assessment which consists of clinical breast examination by the doctor, a breast imaging with mammogram or breast ultrasound, and a core needle biopsy to test. What's the difference between a breast lump and a breast cyst? A breast lump is a solid lump, while a breast cyst is often a fluid-filled sac. Do all breast lumps need surgery? No, most benign lumps simply need monitoring. Surgery is only recommended only if the lump is growing, it's painful, causing cosmetic concerns, or it is suspicious. Are there medicines to treat or shrink the breast lumps? No, there are currently no medications that can remove or treat common benign breast lumps. Can food, use of certain wired bras or deodorants causes breast lump? No. None of these have been proven to directly cause the development of breast lumps or even breast cancer. However, a healthy lifestyle is still important for your overall health. My breast lump is only 1 centimeter. If I don't remove it now, will it continue to grow bigger every year? Not necessarily. This is a common concern for most women. The good news is that most benign breast lumps, about 90 to 95%, will remain stable in size for many years. Some may even become smaller over time. However, a small percentage may also gradually increase in size or even change in shape. That is why it is important to have yearly breast screening and monthly or regular breast examination for you to look for any new or unusual breast changes. Sometimes, measurements reported may vary between a few millimeters because it is measured by different times by different doctors and how the scan is performed or used. So example, if you have a grape, some may measure it horizontally or vertically or even obliquely, and all the measurements will be different, but it is still the same grade or the same lump. Do birth control pills or hormone replacement therapy causes breast cancer? No, they do not directly cause breast cancer or the development of breast lump. Some hormonal therapies may slightly increase the risk depending on the type, the dosage, and the duration. But for many women, the benefits of using this may outweigh the risks. So discuss your individual situation with your doctor. What is BI-RADS classification? This is often seen in your mammogram or your breast ultrasound report. BI-RADS is a simple scoring system used by the radiologist to describe the mammogram or the ultrasound or the MRI findings. This is to tell the doctors if the lumps are likely to be benign or likely to be suspicious or cancerous, or if it needs further investigation. So generally, if it's BI-RADS 0, it needs further investigation, or you need to see your doctor to discuss further. If it's BI-RADS 1, 2, or 3, then most likely it is benign changes. And if it's BI-RADS 4 or 5, then it is suspicious or cancerous and need further investigation. So please check out my other video that I have explained more in detail. So when you have a breast lump, when should you worry? Seek medical attention if you notice there is any unusual or new changes in your breast, such as a new persistent breast lump, any skin dimpling or changes or thickening in the nipple if it's a bloody nipple discharge, or even any unusual lump in the axilla or the armpit. If your mammogram or your ultrasound report says that it is a BI-RADS 4 or 5. Just as women are often concerned about any new wrinkles or new cellulites that develop on their face or their body, we should also pay similar attention to our breasts. The most important thing is to remember this: finding a breast lump does not automatically mean that it is breast cancer, but every new breast lump deserves a proper assessment and investigation. Learn and perform monthly and regular breast self-examination to understand your own breast. Go for yearly breast screening with mammogram or breast ultrasound. Early assessment leads to early diagnosis, and early diagnosis leads to better outcomes. Thank you for watching. I hope this information has been useful, and take care. I will see you in my next video.